So we get asked a lot on BSA. I get messaged quite often, oh, Tash, I'm too embarrassed. I was so embarrassed to ask my surgeon, but when are you allowed to start having sex again? Or the other one is it okay to have oral sex? What if, what if I swallow fluids? Can they get into the staple line? Blah, blah. Take it away, Dr.
Well,
Michael.
that's not that common a question, I guess, because people they don't ask. Exactly. So it's something that's really important to talk about, isn't it?
Yeah.
So obviously, sex varies in terms of its intensity and its physicality.
Yeah.
But essentially, I think it'd be safe to do as long as it wasn't exacerbating any symptoms, which is the same as all physical activity.
Yeah.
So if you're having sex and there's no pain, it's not exacerbating your wound pain, you're not doing any particular movement that's causing a pulling or a tearing sensation, then that's going to be fine. And I think for most people, as you know, most people when they go home, they have 1 or 2 pain tablets, but not a lot. So for most people, I think by the end of the week, they could be having relatively gentle sex at that time, and that'd be totally safe. There'd be very little that could go wrong. If you really wanted to get into it, if you really wanted to get into some vigorous sex, then probably you'd have to wait the normal time we recommend for heavy lifting, which is a month.
Yep. Okay.
And as you know, most people are going back to the gym at a month.
Yep.
So, depends.
Yeah. So no chandelier swinging early on.
Wait till you're home from hospital.
Yeah. Yes,
I've actually got a story about that.
We know. Okay, great. Yep. Awesome. That's good. Yep. Oh my God. Oh my goodness.
See, everything in moderation.
Yes. Moderate people, not.
Yeah.
Wow. Goodness me.
Awesome.
Did you have to get that one out? No, fair enough. Yeah. Wow. Okay. And yeah, they're okay though.
Did they get their toy back? Yeah.
Yeah, I was going to say, I mean, wow.
Well, I actually saw an article, I think I read it to you, didn't I? Someone in the UK had to have an MRI, and they left because they thought that they had a silicone butt plug, but it had a metal core in it, and it boarded up into their chest cavity
when they did the MRI.
Yeah. So
be careful. Be careful. Stay safe.
Yeah. I was because they actually showed the X-ray.
Yeah.
They showed the X-ray of this person. I was like, oh my God, that poor person.
Because I'm always like, Damo, have you put this through? Are we sure that this is a real thing? He's like, yes. Okay. Yeah. That's true.
What do you think would be the most frustrating myth that you have patients believing?
Yeah.